Marissa, and I will explain a few needed information about what is breast cancer. So first of all, breast cancer is a disease in which cells in the breast grow out of control. There are different kinds of breast cancer, depends on which cells in the breast turn into cancer. So breast cancer can begin in different parts of the breast, which mainly there are three parts: lobules, ducts, and connective tissues. So most breast cancer begin in the ducts or lobules. Breast cancer can also spread outside the breast through blood vessels and also lymph vessels. Furthermore, some of you must be wondering, do men ever get breast cancer? Well, the answer is yes. Although it is rare, but men can get breast cancer as well. It is mostly found in women, but about 1 out of 100 breast cancer diagnosed in the United States is found in a man. So that being said, the breast cancer that man gets is just as serious as the breast cancer woman gets. It also has the same symptoms. And now I will point out about the breast cancer survival rate. So it rates very widely based on many factors. Two of the most important factors are the type of cancer you have and the stage of the cancer at the same time you receive a diagnosis. Other factors that may play a role include your age, gender, and also race. But the good news is breast cancer survival rates are improving. I hope I've made a very clear understanding about a few things on breast cancer. Now I will pass on to my friends to explain more details about breast cancer. That is all from me. Thank you.
Assalamualaikum and hello again. Let's proceed with the stages of breast cancer. Basically, there are 5 stages of breast cancer, which start from stage 0 until stage 4. First is called stage 0. Stage 0 is the earliest of non-invasive breast cancer, and there is no indication that the tumor cells have spread to the other parts of body. Next, stage 1, which also the earliest and invasive breast cancer. At this stage, the cancer cells have spread beyond the original location and into the surrounding breast tissue. Move on to the stage 2, which known as invasive breast cancer, but the tumor measures between 2 to 5 cm and the cancer has spread to the lymph nodes under the arm. Also, tumor may be detected during a breast self-exam. Second last, stage 3, which locally advanced breast cancer, where the tumor is more than 2 inches across. The cancer is extensive in the underarm lymph nodes, and it may possible dimpling, inflammation, or change in the skin color. Lastly, stage 4, as called as metastatic breast cancer. At this stage, the cancer has spread beyond the breast, underarm, and internal mammary lymph nodes. Besides, it also has spread in the body and may affect bones, brains, lungs, and liver. Assalamualaikum and hello everyone. So in this video, I would like to share about the symptoms of the breast cancer. So stay tuned. So the first symptom of the breast cancer is lump, when there is a new lump or thickening on the breast or armpit area. Second, skin dimpling. Dimpling of the breast causes the skin to look like the pitting and uneven skin of an orange. Third is nipple discharge, when a clear or bloody fluid that leaks out of the nipple, which can be thick or tint of discharge that can vary color from milky to yellow, green, and red. Fourth is redness. Breast cancer can cause changes to the skin that may make it appear discolored or even grease. The skin may be red, purple, or have bluish tint. Fifth is swelling. The breast may be different in size than the other breasts, and the skin may also feel tight due to swelling. 6. Breast or nipple pain, which can cause changes in skin cells that lead the feeling of pain, tenderness, and discomfort in the breast. Last but not least, change to the skin texture. Skin texture will changes and inflammation will happen in the skin cells that can lead to scaly skin around the nipple and skin thickening of any part of the breast and may also cause itching. And that's all for today. Thank you.
Hi, I am Amyra Binti Razak. There are many different types of breast cancer and different ways to diagnose them. According to American Cancer Society, the type of breast cancer is determined by the specific cells in the breast that are affected. The major type of breast cancer is invasive and non-invasive. Invasive breast cancer is a disease that has already spread to other parts of the body and started to affect the internal organs, while the non-invasive breast cancer is a cancer that remains in a particular location of the breast but have not spread to surrounding tissues, lobules or ducts.
This is the other types of breast cancer. There are also a lot of rare breast cancer, and some of breast cancer are more aggressive than others, such as triple negative breast cancer and inflammatory breast cancer.
There are many ways of treatment for breast cancer, and all breast cancer have these two main goals, which is to rid the body as much of the cancer as possible and to keep the disease from coming back. Primarily, breast cancer treatment is based on the type and stage of the cancer, and usually the medical team will have discussion before they recommend treatment for their breast cancer patient, as the treatment also depend on other factors including the type of breast cancer, how fast it growing, overall health, and personal preference.
In stage 0 breast cancer for DCIS, they will usually do surgery, radiation therapy, and hormone therapy. But for LCIS, hormone therapy is the common treatment as to lower the risk of developing invasive cancer followed by double mastectomy. For stage 1 breast cancer, surgery is the standard treatment for this early stage. Other treatment for this stage include radiation therapy, chemotherapy, hormone therapy, and targeted therapy. For stage 2 breast cancer, surgery also is standard treatment for this stage, followed by radiation therapy, chemotherapy, hormone therapy, and biological therapy. For stage 3, chemotherapy is the common therapy usually before they do the surgery to shrink the tumor and make it easier to remove. Other treatments are radiation therapy, hormone therapy, targeted therapy, and immunotherapy. With stage 4 breast cancer, the cancer has spread to other parts of the body. Bones, lungs, brains, and liver are often affected. Eventually, chemotherapy is the main treatment for this stage as it can slow down the growth of the cancer. Surgery or radiation therapy might use in some cases. Other than that, hormone therapy, targeted therapy, and immunotherapy also can be helpful for this stage of breast cancer.
Hello everyone, my name is Nurfadhilah binti Nazaharudin and I'm from BA118 Today I want to talk about the risk factors for breast cancer. The first risk factor for breast cancer is getting older. The risk of breast cancer increases with age. It is because most breast cancer are diagnosed after the age of 50. The second point, not being physically active. This type of women who are not physically active have a higher risk of getting breast cancer. After that, being overweight or obese after menopause. Older women who are overweight or obese have a higher risk of getting breast cancer than those at normal weight. The other point is involved genetic mutation. Women who have inherited these genetic changes are at higher risk for breast cancer. The second last point is the history of breast cancer in the family. If you have a first-degree relative such as your mother or your daughter or maybe your sister who has breast cancer, or if you have several relatives who have breast cancer, particularly before they turn age 50, you might be at higher risk for breast cancer. Drinking alcohol is the last risk factor for breast cancer. Studies indicate that a woman's risk for breast cancer increases with the more alcohol she takes. That's all from me. If you have any symptom that may be related to the breast cancer, please go to the hospital for checkup. Please stay safe. Thank you and Assalamualaikum. Bye-bye.
Assalamualaikum and hi, I'm Hani, Aqilah, Binti of Bukhari. So in this part, I would like to share with you guys on how breast cancer can affect someone's lifestyle and a random story from a survivor. So during the treatment, patients are likely to experience hair loss, which causes by the chemotherapy. But do not worry, it is only a temporary issue because your hair will regrow once you finish the treatment. Next, you will be facing menstrual changes, which likely to experiencing you from a night sweat, a joint pain, and weight gain. Also, you will be facing swelling, which causes by the lymphedema. What is lymphedema? It is a condition which collect fluid in your different parts of body. And also, you will be experiencing skin changes, which causes by the radiation. Last but not least, you will gaining so much weight due to the hormone therapy result from the chemotherapy. To the breast cancer survivor out there, do not lose hope because lots of patients are now free. Do you guys know that one of the survivors was our ex-Prime Minister wife, which told Siti Hasmah? She got diagnosed on March 2019. Doctor confirmed that there was a small lump on her left breast, and she decided to remove it earlier. Regarding her speech on event in HL, she stated women nowadays are generally afraid of taking screening tests because they feel embarrassed due to the process. She also reminds us to do a health checkup regularly and do not risk our life because it can be prevented earlier. So to women out there who are having even a simplest sign, please do check up earlier as can be cured in early stage. The earlier the treatment, the faster the recovery.